In children younger than age 5, it's normal to not have full bladder control. As children get older, they gradually learn to control their bladder. By age 4, most children successfully achieve daytime bladder control, and by 5 to 7 years of age, most children are dry at night as well. Enuresis, that is a medical term for bedwetting, happens in children who are old enough to control their bladder. Enuresis is generally classified into two major groups: nighttime or nocturnal wetting, and daytime or diurnal wetting. Note that nocturnal enuresis accounts for nearly 80% of bedwetting. Thereby, enuresis is often synonymous with bedwetting that occurs only at night. According to medical terminology, enuresis is defined as discrete episodes of passing urine during nighttime sleep in children older than 5 years of age. Enuresis is a well-known, low-severity, high-prevalence condition in pediatrics. Its prevalence is affected by multiple factors including age, gender, and genetics. The number of children with enuresis declines with increasing age. For example, at 5 years of age nearly 16% of children experience enuresis globally, while only 1–2% continue to wet the bed by age of 15. Additionally, boys are twice likely as girls to experience enuresis. Researchers have long known that enuresis is a highly heritable disorder. Almost all studies reveal a strong genetic predisposition at rates of familial history as high as 75%. A recent study on more than 3,800 enuresis cases reveals that particular genes on chromosomes 6 and 13 are significantly associated with nocturnal enuresis. For most children, enuresis resolves by the passage of time and does not require any specific treatment. However, the emotional impact of enuresis on children and families can be considerable. Enuresis can cause feelings of embarrassment, anxiety, and loss of self-esteem in affected children. Studies demonstrate that behavioral and emotional disorders are 2 to 3 times higher than in children without enuresis. Therefore, the most important reason for treating enuresis is to improve self-esteem, even if treatment is not completely successful. The first and most important step in enuresis treatment is identifying and managing underlying health conditions. Constipation, sleep apnea, urinary infections, diabetes, excessive fluid intake also known as polydipsia, kidney disease, and attention deficit hyperactivity disorder or ADHD, are the most common associated conditions. Fortunately, majority of children do not have any underlying health problem. In addition to treating underlying health problems, lifestyle and home remedies are proven to be useful as well. First, remember that neither the child nor the parents are at fault for enuresis, so children should not be punished at all. Unfortunately, studies reveal that nearly half of enuretic children are punished for wetting the bed. Condemnation, depriving desires of the child, humiliating the child in the presence of other children, and reprimanding or threatening are various punishment methods that families use. Sometimes the punishment is physically abusive. Next thing is trying to encourage the child to void a total of 4 to 7 times per day, including just before going to bed. Enuretic children should drink most of their fluids in the morning and early afternoon to prevent overfilling of the bladder during the night. Note that, if you are not careful enough, fluid restriction can lead to dehydration and subsequent constipation, which is a well-known cause of bedwetting. So, always consult with a physician before applying this method. As with most conditions, a healthy diet can go a long way in the path towards improvement. Here are several nutritional tips to hasten bedwetting resolution. Chocolate, salt, sugary drinks and caffeine are linked with bedwetting, so withhold these foods and drinks after 4 p.m. On the other hand, since foods made with white flour can induce constipation, try to avoid white bread and pasta and stick to whole grains instead, especially if constipation is the underlying cause of enuresis. Moisture alarms and medications like desmopressin are not first lines of treatment for bedwetting. These treatments are used only if 3 to 6 months of initial management does not improve patient symptoms. We will fully discuss them elsewhere. Thanks for watching this video. If you are eager to learn how to treat yourself at home, subscribe my channel and ring the bell to get notified when new videos are released.